want to talk about health disparities throughout various communities. And so today, we have Mrs. LaShonda Bates, and as you can see, she works at Bronson Hospital. She is in their cancer center, which was very interesting to me when she has, since she has done research on African Americans and cancer, with their cancer rate. And so I wanted her to talk about that, what she found out, and can we start deducing some concerns about how people are cared for. So I'm going to let her go and do her thing because she knows what she's doing. And certainly feel free to ask questions as we go. Thank you.
Good afternoon, everyone. I am LaShonda Bates. Thank you, Dr. Dennis, for inviting me today. Thank you, College of Health and Human Services, for just giving me space to come in and talk to you all. It's always a blessing to be invited back to my alma mater. Go Broncos! So, today we're going to be talking about African Americans diagnosed with cancer. Now, here's today's agenda, what we'll be going over. We'll be going hot and heavy. But please, at any moment, please raise your hand, ask questions. I want this to be engaging. If something's not clear, let me know and we can unroll it and look at it a bit closer. So first thing on our agenda is to talk about point of view. I don't know if, I'm sure you all have become familiar a little bit with intersectionality. And when you're talking about research, it's so important that you understand your point of view, because your point of view will always show up in your research. No matter how neutral you try to be, I look at numbers all day long. We can make numbers say exactly what we want them to say. So one of the things you will see throughout my presentation is I will continue to mention the importance of not analyzing data on your own. It is important that you have a team, that you have stakeholders, that you're involving the community in which you're trying to learn more about or trying to sort of close those gaps for. So, I am a Bronco. I'm from Muskegon. Muskegon is about an hour and a half north of here off of Lake Michigan. So I grew up ice fishing. I grew up snowboarding. I grew up around the dunes, riding dunes, bonfires, you name it. Everything outdoorsy, we did it in Muskegon. I came to Bronson for my undergrad, I came to Western for my undergrad years and years ago, many moons. And I met the love of my life here. And so that's my husband there, Hal. And these are our 3 children. I did some studies abroad. I did a stint in Peace Corps. I've worked with a vast range of not-for-profits. Everyone from Planned Parenthood Global to smaller NGOs in Namibia, where I worked with a girls group called Fawina, where we taught learners how to stay in school. You know, and we provided for their needs, whether it was uniforms or making sure they had food. I did a lot of resource and capacity building for organizations throughout my career. And so I've now currently at Bronson, and I lead a cancer care equity project. So the goal of the project is really to identify disparities. But the great thing about it is that I get to do it in partnership with my community. So, we can't talk about cancer unless we have a shared meaning or a shared understanding of what cancer is. So, what is cancer? Cancer is when abnormal or old cells in the body don't die, because your cells have a lifespan, right? And so they're supposed to die off, and you get new cells. With cancer, the bad cells continue to grow, and they crowd out the good cells. This makes it hard for your body to work the way it should. And there are over 200 cancer types. Each of those types have a subgroup. Cancer is named by where it starts in the body. So you probably have all heard about cancer metastasizing. So for example, if you start with a brain cancer or a brain tumor, it may spread to your lymph nodes, or, the longer it goes untreated. It goes through, and it's rated by stages. You can go from 0 to 4. 4 being it hasn't quite, it has metastasized, and 1 being it's usually in the same location where it started. 1 in 2 men will be diagnosed with cancer in their lifetime. 1 in 3 women or females will be diagnosed with cancer in their lifetime. So what we're seeing with cancer is that it's starting to increase. You'd be hard-pressed to find an individual in the United States of America who has not either been diagnosed with cancer or who does not have a loved one or a friend who has been diagnosed with cancer. It is very real. So one of the things that I wanted to go over is how we address cancer. Typically, an individual, the idea is for you to be an active participant in regular screenings. Those are self-screenings, such as I wrote, know your body. You need to know your body. You need to be your number one advocate. You should start doing self-breast exams at puberty. You should start doing, and this is for males too, the number of males that are getting diagnosed with breast cancer, that number is also increasing. If you have testicles, you need to start doing a testicular exam, puberty. And it's important because as you get older, your body starts to change. You should be noting those changes. If you see any lumps, any discoloration, any constant pain, anything that's out of the ordinary for you, even if you think it's small, contact your primary care physician and get it checked out, and be an advocate. If it's something that's persistent and you feel like you're not being heard, you have to continuously advocate for yourself. Participate in regular screenings. Now, we only have so many screenings that are available that will be offered to you regularly. Most of the time, you're not going to go to your primary care physician and they're not going to recommend you for an MRI. That we don't screen for tumors in your head. We don't do that. But what we do regularly screen for, we screen for breast cancers, cervical, colorectal, lung, and prostate. That's why it's important to have a primary care physician, because they're going to talk to you about your family history. They're going to talk with you about your risk for obtaining certain types of cancers. So it is vital that you have those conversations, that you're aware of when you should start getting breast exams. Some individuals with breast cancer in the family will typically start getting those mammograms or doing self-breast exams and being on top of that if they have a deep family history. So it'll be a lot younger than when you typically will see an individual start to do mammographies. I know individuals that have started doing mammographies at age 25. So it's important that you talk to your physician and that you have a plan of action for you as an individual. Now, available resources. We have at Bronson what's called a primary care physician line. And so you can call this phone number, and it's 269-341-7788. This number you can call if you have a question about your health care, if you have a question about, I'm not feeling well, what should I do? I'm looking for a primary care physician with long hair and brown eyes. They can help you identify someone that will work for your needs. Enroll in marketplace insurance. If you don't already have insurance, I know some of you may be under your parents' insurance. However, for those of us who don't have that option, we have a number here. It's 269-341-8355. We also have the website here as well. It's healthcare.gov. But you can contact or reach out and find out what your particular health insurance options are. Going back into cancer diagnosis. Okay, so this is what we know. The top 5 cancer diagnoses are lung, breast, prostate, head, neck, and colorectal. Lung cancer is the leading cause of cancer deaths in both men and women aged 50 years and older, causing far more deaths than breast cancer, prostate cancer, and colorectal cancer combined. This is important because oftentimes lung cancer goes undiagnosed until you start having symptoms. And when you start having symptoms of lung cancer, your survivorship or your survival rate decreases tremendously. So if you have a history of lung cancer in your family, if you have a history of smoking, it's important that you're doing those screenings, that you've talked to your primary care physicians and that they've started screening for that, because not everyone will be offered a low dose. And so that's how we test for lung cancer. So it's important to really begin to have those screenings if it's medically indicated for you. Now, nationally, Black individuals residing in neighborhoods with the highest socioeconomic status are more likely than white individuals residing in neighborhoods with the lowest socioeconomic status to be diagnosed with advanced stage lung cancer. What does that mean? That means that if you're Black in America and you live in what's considered a great neighborhood, you have a great job, you're making great income, you have great health insurance, you go to your screenings, you take care of yourself, you're checking all the boxes. You're still more likely not to survive your cancer diagnosis than a white individual residing in a lower socioeconomic neighborhood. For most types of cancer, Black people have the highest death rate and the shortest survival of any racial ethnic group in the United States. This stat is across cancer types, even in our own community. If you reside on the north side, you're less likely to survive your cancer diagnosis if you're Black than you are if you live perhaps in 49006. Black women are 41% more likely to die from breast cancer than white women. Individuals with breasts that are Black, that are diagnosed with breast cancer, are typically diagnosed at a later stage, stages 3 and 4. And the later stage that you're diagnosed at, the less treatment options are available to you. Now, the thing about these stats is that fewer Black women are diagnosed with breast cancer than white women. But even with that, you're still more likely to die from your diagnosis. So what's contributing to the disparities? We have systemic racism. Now, systemic racism speaks to systemic policies and practices, things that have gone down for generations. You know, not being eligible for health insurance, not being allowed into certain medical facilities, not being offered medical treatments when you should probably be receiving them, but not still being offered them. Medical professionals making decisions for you, not even putting options on the table. Medical professionals not listening to your story, you know, telling you, well, hey, you know, it's not a big deal. You know, everyone gets pain in their breast around that time in the month. You know, so sort of being dismissed. Lack of trust in the healthcare system. So we know, most of us know about the Tuskegee research practices that happened. You know, how Black men were mistreated during a research study. Many of them died. And healthcare was withheld from them, and they were experimented on against their will, without their consent. That leads to a severe distrust with the healthcare industry. Even till today, when we were talking about the COVID vaccinations, a lot of people refused to get them in the African American community because they thought about things like that. You know, and we still have these conversations. When I go out and I do focus groups, that's still one of the things that sort of floats to the top in those discussions, that lack of trust, that sort of not knowing if I can trust individuals with my health care. Unknown family history. We talk a lot about genetic counseling. There's a lot of research around genetics and cancer. But if we don't talk about, one of the things in the African American community is stigma around cancer. My personal journey, I didn't know that my grandmother had a mastectomy until the whole family, no one knew until she got to a point where she no longer could take care of herself. So my mom goes in to give her the first bath. And she looks at her chest and she goes, what in the world is that? So I remember being a teenager and hearing my mom on the phone with her sister going, did you know about mama? What's going on? Nobody knew anything. But she also came from a generation where we don't have access to those health records anymore. And she was in later stages of her memory journey, and so we couldn't ask her. But no one could answer that. So it's so important that when you start talking about, cancer, that it's a conversation that we have in our homes, that we have with our family, that we understand our history, and that we're sharing it with one another. Because one person's journey in your own family could save so many other lives. Also contributing factors to the disparities, not having a primary care provider. In my focus groups, one of the things that kept coming up was, yes, I have medical insurance, but I don't go to the doctor regularly. Why not? Well, the doctor that I have, I really don't like that doctor. Okay, well, you can get a different doctor. No, I tried. Or, I'm fine. Everything's fine. It's fine. And so not having a consistent primary care provider, someone that you trust, someone that you're able to feel like you're building a relationship with, someone who understands your journey, your health journey, is so important. For those of us in the room, if we don't have a primary care provider, that's something we need to start looking and exploring having. Because it's important that when you go in for your health care, that you understand it's a partnership. Your medical provider is your advisor, right? They're going to tell you, okay, based on your history, based on your lifestyle, this is what you should be doing. Also, another contributing factor is low research participation. That goes back to horrible research practices. So oftentimes when we have new drugs on the market that, certain trials that they may be eligible to participate in, we're less likely to participate in because we don't know, we don't trust the system. And so there's that lack of engagement in research trials. And if we don't have people of color participating in research trials, then when it hits the market, we have no way of knowing how it's really going to impact certain parts of the population. Also, cost is a huge thing. It's huge. A lot of our patients sometimes feel like they have to choose between their cancer treatment or going to work and providing for the family. Think about it if you're a single parent. You have kids to worry about, but then you're thinking, okay, I've been diagnosed. I have to be here, so what do I do? So one of the things that we try to make sure we do at Bronson is talk about the cost of care. No one ever at our cancer center is turned away because they can't pay. We have so many things built in internally, everything from transportation to support groups to social workers who can't tell you how many conversations our social workers have on a regular basis where they're just talking to one of our patients about things that's going on in life. They don't need anything in particular, like I don't need my utility bill paid today, but I just need someone to hear me. And so those things are important that we built that in the motto that we have, that we're providing services to the entire person. And I'll just highlight here trauma. Trauma-informed care is so important. It's important in everything we do across the realm of healthcare. Everything, whether you're offering yoga classes or you're doing hair, trauma-informed care is so important when we're talking about our medically underserved community members, and not just African Americans, but all of this really applies to everyone. So I'm going to tell you more about the Cancer Care Equity Project. Did we have any questions about cancer overall? No?
Specifically about cancer, but on that previous slide, I was just kind of thinking, and so I'm
Mm-hmm.
Obviously the things that are specific to Black women in the United States, that is one topic of conversation. And I think, like, I'm probably not the best person to counsel,
Mm-hmm.
but I can do my best and maybe connect them with another Black woman. But some of the stuff on there is sort of universal in the horrible state of our healthcare system.
It's true.
And so if you are talking to a Black woman, how do you counsel them on, it is hard to find a primary care physician even for a white upper class person, because you have to see what your insurance covers and see a lot of like the PCPs are not accepting new clients,
Mm-hmm.
and then you have to get an appointment. So I was wondering if you could speak to that a little bit.
Absolutely. Well, first things first, it's about showing up. We don't always have the answer to every single question, but it's about showing up. It's about engaging. It's about walking through with that patient and saying, okay, I'm not quite sure, if we can find this particular physician, you're looking for, but let's see how close we can get. It's understanding that what I found out is that our patients aren't looking for us to have all the answers. They understand that, you've been hired at Bronson and you're doing your job as a social worker. They're not expecting you to fix healthcare, right? So when they call, if they have a question, if they're African American women, the first thing you can do is just approach the individual as an individual and understand that each and every person, even in this room or even who we're working with, they're who they are as a person first, right? And so that's how we approach it. I myself, when I was looking for a primary care physician for, a pediatrician for the little people, I call them the little people, my kids. When I was looking for a primary care physician for them, I had in my mind who I wanted, them to see. But that person wasn't available. We didn't have anyone in the system who met those requirements. And so I went in with an open mind, but also, I had a colleague who was helping me out as well, helping me try to figure out who would be the best fit. But it landed, it sort of boiled down to just a few points. Who made space for my concerns? Who took the time when I went into that appointment with them, with my little people, and made eye contact? Who engaged my little people? Who got down and went like this? How's your day going today? Are you having a hard time breathing, my little one? One of them have asthma. But it's about connecting. That's what it's about. Because we can't always check all the boxes. But if we show up and we say, you know what? I'm here to help you. I'm here to help, this situation and do what I can. And when I give you referrals, I'm giving you those referrals, and I want you to know I'm doing it in good faith. That's how we show up. Okay, Cancer Care Equity Project. So I started this project with Bronson back in the summer of 2022. Okay, back in the summer of 2022. One of the things that I did initially, out of the gate, because they wanted me to identify disparities or gaps in service delivery across the continuum of cancer care. Imagine going out to the community and say, okay, tell me about your experience with the continuum of cancer care. Most people were like, what are you talking about? So I said I need a visual. So what I've done is create this tree. Now, the continuum of cancer care talks to the journey or the path that a disease site perhaps takes, right? It's the life course of something. You'll see this when we're talking about our senior citizens, and we have a continuum for senior citizens. We have it really across the disease sites. So here, we're talking about cancer specifically. We have environmental health. We have prevention, diagnosis, treatment, survivorship, and palliative care. Environmental health really talks about what's going on in your world. Where do you live? Why is that important? Do you have access to safe and affordable food? Do you have access to healthcare facilities? Has someone talked to you about what cancer is and how it may or may not impact your life? Environment. Prevention. That speaks to, do you have a primary care physician? Are you underinsured? Are you perhaps getting the nutrition that your body needs? That's prevention. Are you having conversations real relevant, not just, checking box conversations with your primary care physician, but are you getting in there and really talking about the thing that you really want to know? Diagnosis. This is the part of the journey where an individual may be diagnosed with cancer. Where you're diagnosed is huge. Are you diagnosed at your regularly scheduled screening appointment? Or did you show up at 3 a.m. in the morning at the ER because you couldn't take the pain anymore? Those are huge, huge, disparities. When we talk about disparities, where you're diagnosed really says a lot about this part of the journey. And that's usually where my work is. So it's not a black thing, it's an us thing. Because you can check all the boxes, but if you present at the ER, we need to have a conversation, So I put my investigative hat on and I'm trying to figure out, what else should I be doing in the community to educate? How can I make sure I'm reaching that part of the population who's not getting their regular screenings? Treatment. This is huge. This can lean towards, can you afford treatment? Do you have transportation to get the treatment? Or were you diagnosed and did fear come in and you never went and got the treatment? So I look at that portion of the continuum as well. Survivorship and palliative care. Survivorship, everyone who's been diagnosed with cancer is considered a survivor. Whether or not you were able to ring the bell, you are considered a survivor. Palliative care. That speaks to how are we providing comfort to individuals that are undergoing treatment. That also speaks to individuals that rung the bell. Are you coming back for your checkups? Are there barriers there? Are you lacking transportation? Are you nervous about coming back after you rung the bell? Does everyone know what the bell is? Yeah, I have to say it just in case. So the bell at the cancer center, at most cancer centers, there's a bit of a celebration that happens when you get through your entire treatment, right? Your last day of treatment, you just finished treatment. It's worth celebrating. So we have a bell. Everyone celebrates. So palliative care also looks at, do we need to provide yoga to this individual that's undergoing treatment? Or do we need to look at other maintenance strategies to make this person feel, more supported or more comfortable while they're undergoing treatment? Palliative care can also mean end-of-life care. That goes and it wraps back around to how can we make this person feel more supported? How can we support the family? What are some things we can do to make this person feel more comfortable while they're transitioning? So that's the continuum. Now, with all trees and all growing plants, there are roots, right? And the roots that we have here, it's really what I hope through the project we're able to infuse into the continuum. So on the roots, we have social support structure. Who's there supporting our patients? Who's there supporting, whether it's family, friends, loved ones, partners? Who's there to support? How are we supporting them? But also that talks to what are we doing internally? Is it that conversation with social workers? Is it the connection they have with nurses? All of those play a huge part in someone's journey. Empowerment, understanding that your care and your journey within cancer, it's a partnership. You need to feel empowered on your journey. That you have the right to say no. You have the right to say, I need a moment. I need to just think about this. I need to go meditate. I need to pray. I need to go scream. Give me a moment. You have the right to do that, and it's about empowerment. Equity. Are we meeting everybody where they need to be met? You get diagnosed with cancer, most people don't hear that first conversation after you say you have cancer, right? So we need to revisit that conversation. We need to make sure that if there's support people there, that they're hearing the portion that needs to be heard. This person's getting time to process, and we're just making space. A lot of healthcare, we're moving into an area where we understand we need to have space. We need to make space for people's feelings. We need to make space for people's experiences, because the more space we make, it allows us to hear, it allows us to understand, it allows us to process with you and really make decisions alongside you of how we continue on your path, on your healthcare journey. Then we go into cost of care, and we talked a little bit about that. Support services, we have wonderful financial navigators that can help you with everything from applying for medical insurance to figuring out what goes where in terms of finances. Community partnership, that's huge. I've spent a lot of time in the community. One of the things I did with this project from the very beginning, after I did this, was I started going out into the community. Because how are we going to understand where the gaps are in service delivery if we don't invite the right people to the table? And sometimes when we invite the right people to the table, it's just to check a box, right? How often have you been invited to the table and everyone's like, shh, you're just here for optics, right? So we have to change the narrative. And in changing the narrative, it goes back to empowerment. So one of the things that I did was I went out into the community. I did surveys, which is really hard these days. We're actually trying to get away from surveys in research, because how difficult is it to craft a research question or to craft a survey question and get exactly the information you're looking for? And you can't ask follow-up questions on a survey, but that's a rabbit hole for another day. So one of the things that I did in addition to that was I did focus groups. I invited people to come talk to me. Where did I find these people? I attended events, word of mouth, the snowball effect. That's what I did. I went out, talked to people, and people say, you know what, you should really talk to so-and-so. And so I had a whole collection of people, and we went over and we had a discussion. And I let them speak. And I listened. And I said, tell me more. Well, I've never heard that before. Tell me that too. But I made space. Advocacy, inclusion, access. Advocacy, it's about showing up for people who may not be able to do it for themselves. It's also about empowering people to be able to advocate for themselves. One of the things that we're working on doing is teaching people how to ask the right questions. Right? We can't, I think sometimes we assume when our health literacy increases as an individual, it's so difficult to go back and say and understand that not everybody has the same level of health literacy. So it's teaching people how to share their medical experiences and their medical journeys with other medical professionals, but also be able to ask the right questions. That's so important, because we can't assume our medical professionals know exactly what you're thinking. If you're sitting there the whole time and you're just going, okay. That physician had no way of knowing that you didn't have transportation to pick up your medication. They didn't know you couldn't afford to pick it up, or that you had to pay groceries this month, or that one of the little people decided they wanted to participate in swim and you just don't have the heart to say, Mommy needs to get her medication. But that physician had no way of knowing that. So it's teaching our community members how to advocate for themselves, whether that's writing notes, whether that's bringing somebody along with them, but it's making sure that when we invest the time and effort into the roots of this wonderful tree, then we can start impacting the continuum. And we can do it in partnership with our community members. And when we impact the continuum, and we do it strategically, and we do it consistently, then we'll start to bear different fruit. We'll start to have different healthcare outcomes. We'll start to see what our community looks like now. It starts to change. Have you ever seen someone who's really quiet, who always just absorbs things, finally have that breakthrough moment and say, I'm putting my foot down. Today I'm saying something. That's what we want, right? We want people to be engaged in their healthcare journey. All right, any questions about my tree? I'm really proud of this tree. It took me a lot of time. I sent it over to Corp Com and they were like, what is this? So it's cute, it's cute. Okay, so timeline. So what have I been doing with the Cancer Care Equity Project? So the first stage here was exploration. That was the data review for the chosen area. We're looking at Battle Creek and Kalamazoo, identify gaps in available information. So it was sort of an exploration phase, right? That's what you do in research. You sort of see what's out there already, what knowledge is already there, and you really begin to, take your notes and say, okay, there's a gap here. We don't quite know what we need to know. Next phase was design. I determined the scope. I created a sounding board, my stakeholders, but they were internal Bronson stakeholders. So physicians and providers and clinical care staff from across the system. And then with that stakeholder group, we punched out our capacity. So we were able to determine this is what we can do as a system. This is what time frame we can work in as a system, and this is what we can do as system staff. Now, the next phase was collection of data and analysis. So I looked at national data. I looked at available local data. That was the secondary data. What data is available here on the ground? Now, that was easier said than done in Battle Creek than it was here. Collection of data, primary data. I did that through the survey. So I did approximately 300 quantitative community surveys by attending community-based events. It was a very busy summer. But I did that. I also made sure that each individual that did that 10-question survey received a $10 Mara gift card. That's part of equity. That's making sure that if somebody takes the time to share information with you, that not only do you inform them about why they're doing it and the impacts of what they're doing, but you also make sure you compensate them for their time, because time is valuable. And it's time out for the good old days of doing a survey, never hearing about the results, and not being compensated for your time. One of the other things I did was the focus groups. From there, I did interviews, one-on-one interviews with people to find out more information about their lived experiences, because you are an expert in your particular lived experience. The next thing that I did was a rapid tool implement. So in all of this creation, I created here and in Battle Creek community advisory committees. Those committees are tripartite. They're made up of 3 different types of individuals. You have your large organizations, you have your grassroots organizations, and you have just your community residents that are representing themselves. The one I created here, the Community Advisory Committee, or CAC, as I like to call it. No one likes to call it CAC but me, but I think it's a cool name. So the CAC here in Kalamazoo, I created in partnership with WMed's Dr. Dixon. And so these CACs allow us to have a sounding board about what we're doing in the community. You should never, don't even think about creating an intervention to fix anybody without first having a conversation with that body. Don't do it. That's a great way to upset people. It's a great way to make sure your intervention fails. So this is the purpose of the CAC. It's to share the data with them, and then in partnership with them, talk about what's going to help make things better. And so one of the things we're here to talk about is African Americans diagnosed with cancer. How do we make sure individuals within this particular group are getting screenings regularly, that we're finding cancer earlier, that they're able to stay in their treatment for when they need to do it, and they're able to come consistently? What can we create in partnership with these stakeholders, with these community advisory groups, to make sure that we're actually having an impact on making sure people are able to survive their cancer diagnosis? In Battle Creek, I've also created a community advisory committee. Same setup. It's not with WMed, but it's with Grace Health. And you may be wondering, why are we creating these community advisory committees in partnership? This whole thing is about partnership. It's not for Bronson and WMed to tell the community what they're doing wrong. It's to say you have two of the largest healthcare facilities in our area partnering to hear from our community members, partnering to see what we can do better, how we can improve healthcare outcomes, how we can get in front of cancer, because you saw the stats, 1 in 2, 1 in 3. It's time that we stop putting cancer sort of on that back burner. Don't talk about it, don't look, we're going to get our t-shirt when it's time. No, we have to start the conversation earlier. It's about prevention and screening. We need to get out there. It's not just an African American thing, it's an everybody thing. Because the interventions we create are going to be able to benefit everybody. If we need more transportation here for African Americans, then I can guarantee you that somebody who may not have as many barriers will probably eventually maybe need transportation. But we've already created it here, so we know we can benefit from it over here. And so it's about making sure we have the correct things in place. And then the next step will be review and correct. Now, when you're creating interventions, it needs to be a model of not just an end life cycle. There can't just be a beginning and an end. It needs to be a living, breathing thing. So when you create an intervention or you have a project, it's always best to have the capacity to make changes. Because you may create this intervention and we may have all these people in these CACs and everybody's going to say, oh, it's going to work. This is it. This is what we've always been looking for. But oftentimes in projects such as this, people sort of burn out, right? They took too long to get started. People lost interest, or they got started, it didn't work. People just sort of got discouraged and sort of dissolved. So it's so important that you build in expectation, but that you also build in the opportunity to make changes. Maybe we need to tweak this over here. Maybe we need to implement this at this time of year, or maybe we need to involve this partner. But it's also making sure that it's something that we're committed to as a system in order to improve healthcare outcomes, in order to improve cancer survivorship. All right, that's the project. Any questions? No? Okay, thank you so much for your time.
Why is this important to me? Because this past weekend I just buried my friend over in LA who died from breast cancer. So for me, and I know for a lot of you as well, cancer is real and it's killing people. And as you go into these healthcare fields, we want you to think about it. We want you to be conscious of what's happening to different populations. So thank you for sharing the information that you have. What I gave everybody is a survey, a little evaluation. But I do want you to fill it out. If you need one, there's some up here. There were about 50 people in this room. I hope to get 50 evaluations back. And what we're interested in finding out is what drop me a message, and we will take your information and make sure that we're communicating it to the administration. So thank you again. Oh, you got a question? Cool. Have a question.
I'll ask her. I don't know.
No, ask her for everybody.
Unless you're uncomfortable.
No, I'm not.
Okay.
I was curious if you could speak to what challenges and barriers you had to overcome in the system at Bronson to get this project carried out.
Great question. Challenges or barriers I have to overcome within the system. Bronson is a large system. Not everyone shares the same ideals, right? Even though something may be clear to you of why we need to do something, you can't assume that it's inherently important to other people because we all have our different journeys. But as a system, Bronson is committed to accessible healthcare, right? Meeting people where they are. And so one of the great things was that when I was hired, we had a stakeholder group who was committed to the cause of making sure that we improved cancer journey outcomes. And so as a large system, sometimes we run into, having to sort of remind people of why we're doing what we do. Sometimes you have to have those reminders, but through those reminders, it has been proving over and over and over again internally that this is important because we know the rates. So it's not, you can't look at it, you can never look at what I'm doing and say, it's a them journey. Nope, it's a us journey. We're all in this together. When we talk about cancer, every last one of us, we're in this together. And so that's the importance of it. And when we bring home that message, you would be hard pressed to find an individual, not only internally, but externally, or even in this room, who doesn't see the value of making sure that we're increasing accessibility for healthcare and we're increasing accessibility for cancer care in our community.
I just want to make a comment when you talk about your family and not knowing what was going on with your grandmother. Yes, I do know for sure that is a concern in the Black community, but I also do believe it's generational. And I say it to say that what I found is that I could not wait for my parents to tell me. I had to ask specific questions. And once I got asked a question, they would tell me, right? And so that to say that even my father, he had colon cancer, and I didn't know until the colon cancer that previously he had prostate cancer.
Yeah.
He never said anything about it. And so oftentimes people believe that when they get a diagnosis of cancer, that they've done something wrong. Like, what did I do to make this happen, right? First of all. Second of all, even though they're told time and time again it's not contagious, they still believe it is, right? And so they don't want to infect a family member, so they stay secluded. So just keeping all that in mind, and for your own self, for your own family, start to ask the questions, not only of your patients, but of your own relatives. That's right.
And do it, make a plan as soon as possible. As soon as possible. For my grandmother, it was too late to ask those questions. So I'm that little, Jimmy Cricket. I'm here. This is your reminder. Ask those questions. If you can't, relax. Any other questions? You guys snuck up again, like. Okay.